Hi teacher, I'm Angela. I'm studying medicine. I'm in the last year of the career, and today I'm gonna talk about burnout syndrome. Once a doctor says, when you look into the eyes of burnout doctors, the shine is gone. You no longer see the life they had when these physicians started their train or took their first jobs. So, what is burnout? Burnout is a psychological and behavioral syndrome. Emotional exhaustion is one hallmark of burnout. It has been defined as long-term, unresolvable job stress, a sense of being overwhelmed and depersonalized, and lacking a sense of personal accomplishment. It is estimated that on average 400 physicians commit suicide a year in the United States. Medical students are continuously exposed to psychosocial stressors throughout training that, if persistent, can lead to this syndrome. It is also defined as a response which may be inappropriate to chronic emotional and interpersonal stressors in the workplace. The term may be applied to individuals who engage in activities that are psychologically similar to work, such as students. Burnout syndrome among students has the following three dimensions. First, emotional exhaustion due to educational demands. Second, cynicism, indifference or apathetic attitude toward academic activities. And third, low professional efficacy, perception of incompetence as a student. Factors that contribute to significant stress among students in medical schools include adaptation, difficulties at the beginning of coursework due to competitive entrance exams, leaving high school for the realities of greater autonomy and responsibility, and the frustration caused by a basic science cycle that doesn't match the expectations of freshmen who want immediate contact with specific medical disciplines. So, are you on the road to burnout? As we can see here, after depression comes burnout syndrome. So, burnout can lead to anxiety, depression, substance abuse, addiction, and suicide. So, are you in the danger zone? What can you do about it? So, don't worry, there's always a solution, and it could be stress, right? Or you can make a diagnosis by three main approaches, which are recognize, reverse, and resilience. To get a diagnosis, it's always good to visit a doctor. He probably will make a questionnaire, which are called MBI. It has several items that could be affective signals, physical signals, cognitive signals, behavioral signals, and motivational signals. But the most important thing here is to self-care. First, do not harm yourself, right? According to the management approaches, if you have burnout combined with depressive symptoms, you might require pharmacotherapy and psychotherapy. If you have burnout without depressive symptoms, you should require only psychotherapy. So the psychotherapy have several approaches. It could be a person or organizational approach. It could be a therapeutic approach through theological interventions or symptomatic interventions, or it could be through coping strategies, which include active cognitive coping, active behavioral coping, and coping by avoidance. So, what are the lifestyle choices that can prevent burnout? If you have burnout, what you need to overcome it is much the same as what you should do to prevent it, because prevention is always better than cure, right? According to Dr. Kang, which is a psychiatrist from Canada who works in a mental health institute over there, she suggests that including in your daily life the following items will keep you safe from burnout syndrome. So, first, play. This involves stimulating the brain in novel and diverse ways. She said it could mean embracing a hobby that has nothing to do with the task you perform at work. Second, others. Having positive, meaningful social connections is also a proven way to keep stress levels down, said Dr. King. This generally needs to go beyond one's partner and kids. As mammals, we are meant to live in a community, be it friends or extended family. Everyone needs a village of sorts, right? So, the third is downtime. This doesn't mean vacation, obviously, though unplugging for a few days or weeks is certainly helpful. Our brain needs to unwind and recharge on a daily basis. This may mean taking a lunch break instead of gulping down your meal in front of the keyboard, going for a short walk in the evening, or even taking a shower and reading a book instead of spending the last few moments in the day surfing the web. Still, building time for downtime in our busy routine isn't easy, right? It requires a conscious effort. Dr. Kang advises her patients to literally draw up a 24-hour pie chart of their day and make time for a few moments of downtime, but cutting out whatever tasks aren't absolutely necessary. So, life ought to be relished and cherished every day. Remember that. The carrying out park trips up a lot of people, which is why carving some space for downtime often involves enforcing boundaries. Those who wind up with burnout often feel that they have no control of their schedule, and that's because they don't know when to say no. Occasionally, feeling pressure to be agreeable or say yes to things you don't want to can be considered healthy compromise. Constantly feeling pressure to say yes to things you don't want to deteriorates self-worth and mental well-being. As once Mr. Henry Longfellow said, remember not to forget saying who you are while becoming who you want to be. Always keep that in mind and don't forget it. Thank you very much.